Men over 60, I know this sounds absolutely insane, but your toothbrush, yes, the one sitting in your bathroom right now, can give you instant hardness in less than 30 seconds. I'm not joking, and I'm not talking about using it on your teeth. There's a specific spot on your body that when you stimulate it with your toothbrush for just 20 to 30 seconds, it activates a nerve pathway that floods your penis with blood almost immediately. I'm Dr. Elena, and what I'm about to show you is backed by science, costs you nothing, and works the very first time you try it. But you need to watch this entire video because if you stimulate the wrong spot or use the wrong technique, it won't work. Let's go. Before we start, hit subscribe and comment below. Have you ever heard of this technique before? I'm guessing no, because almost nobody talks about it. This is one of those hidden gems in men's health that has been overlooked for decades, despite being grounded in solid anatomical and neurological science. The reason you haven't heard about it is simple. There's no money in teaching you something that costs nothing. Pharmaceutical companies can't patent a toothbrush technique. Supplement manufacturers can't sell you a pill that does what your own nervous system can do for free. So this information stays buried while men continue to struggle unnecessarily. Now I need to explain why this works before I show you how to do it. Because if you don't understand the mechanism, you won't do it correctly and you'll think it's nonsense. Understanding the science behind this technique is crucial because it will give you the confidence to try it and the knowledge to execute it properly. So let me walk you through exactly what's happening inside your body when you use this method. Here's the science. Between your scrotum and your anus, there's a small area called the perineum. Most men have no idea this spot even matters. They've never given it a second thought. It's just that patch of skin between two other areas, seemingly unimportant and completely ignored. But here's what's happening underneath that skin, and this is where it gets fascinating. The pudendal nerve runs directly through this area. This nerve is responsible for sensation in your penis, your scrotum, and your pelvic floor muscles. It's one of the primary nerves that controls erection function. In fact, the pudendal nerve is often called the erection nerve by urologists and sexual health specialists because of its critical role in male sexual function. Without proper pudendal nerve function, achieving and maintaining an erection becomes extremely difficult, regardless of how healthy the rest of your body might be. When you apply targeted stimulation to this area, specifically vibration or rhythmic pressure, you activate the pudendal nerve. And when that nerve fires, it sends a signal to your brain that says, increase blood flow to the penis. This triggers a cascade of physiological responses. Blood vessels in the penis dilate, the smooth muscle tissue relaxes, and blood rushes into the erectile chambers. This is the exact same process that happens during natural arousal, but you're jump-starting it manually through direct nerve stimulation. Now, a 2009 study published in the Journal of Sexual Medicine found that perineal nerve stimulation significantly improved erectile response in men with mild to moderate dysfunction. The researchers were investigating non-pharmaceutical interventions for erectile difficulties, and they discovered that targeted stimulation of this area produced measurable improvements in blood flow and erectile quality. Why does this work? Because you're directly activating the neural pathway that controls erections. You're not waiting for psychological arousal to trigger the response. You're going straight to the source and flipping the switch yourself. Think of it like this. Your nervous system is like an electrical circuit. The pudendal nerve is the wire that connects your brain to your penis. When you stimulate the perineum, you're turning on the switch. It's like having a manual override for your erectile function. Most men rely entirely on mental and visual stimulation to achieve arousal, but this technique gives you a direct physical pathway that bypasses the need for those triggers. This is particularly important for men over 60 because as we age, our nervous system becomes less responsive. The signals that used to travel instantly from brain to body now move more slowly. The connection between arousal and physical response weakens. This doesn't mean your equipment is broken. It means the communication pathway needs a little help. And that's exactly what this technique provides. But here's the key. Most men don't know where this spot is, or they press too hard, or they don't stimulate it long enough. That's why the toothbrush method works so well. It gives you the exact right amount of vibration in the exact right spot. The bristles of a soft toothbrush create a gentle, consistent stimulation pattern that is nearly impossible to replicate with your fingers alone. The vibration frequency is perfect for nerve activation without being so intense that it causes desensitization or discomfort. Now, before I show you exactly how to do this, I need to tell you about one common mistake that will completely ruin the technique. And most men make this mistake without even realizing it. In fact, I've had patients come back to me frustrated, saying the technique didn't work for them, and almost every time it's because they made one of these errors. The biggest mistake is pressing too hard. Your perineum is sensitive. The pudendal nerve sits close to the surface, just beneath the skin. If you press too hard with your fingers or use something too aggressive, you can actually desensitize the area or cause discomfort. Some men think that more pressure means more stimulation, but the opposite is true. Excessive pressure compresses the nerve and blocks the signal rather than activating it. That's why a soft bristle toothbrush is perfect. It gives you gentle, consistent vibration without overstimulating the nerve. The bristles distribute the pressure evenly across the area, creating optimal conditions for nerve activation. The second mistake is doing it for too long. You don't need 5 minutes. You don't even need 2 minutes. 20 to 30 seconds is all it takes. Any longer, and you're wasting time or potentially desensitizing the nerve. I've seen men who thought more was better and spent several minutes stimulating the area, only to find that the effect actually diminished. The nerve responds to the initial stimulation, sends its signal, and then the job is done. Continuing beyond that point doesn't enhance the effect and may actually reduce it. The third mistake is doing it at the wrong time. This technique works best when you do it right before intimacy, within 2 to 5 minutes of when you need to perform. If you do it too early, the effect fades. The increased blood flow and nerve activation are temporary responses that peak shortly after stimulation and then gradually return to baseline. If you wait until you're already struggling, you've missed the window. The technique works best as a preparation, not as a rescue when things have already gone wrong. There's also a fourth mistake that I see less frequently but is worth mentioning. Some men try this technique when they're stressed, anxious, or in an uncomfortable environment. Your nervous system needs to be in a receptive state for this to work optimally. If you're flooded with stress hormones, your body is in fight or flight mode, which actively suppresses sexual function. The technique can still help, but it works much better when you're relatively calm and comfortable. Now, let me show you exactly how to do it. Here's the complete protocol, step by step. Follow these instructions precisely, and you'll experience the full benefit of this technique. Step 1. Find the spot. Sit or stand comfortably in a private space where you won't be interrupted. Place your fingers between your scrotum and your anus. You'll feel a small, soft area. That's your perineum. It's about the size of a quarter. That's the target zone. If you press gently, you may notice that this area feels slightly different from the surrounding tissue. It's softer and more sensitive. Some men describe feeling a slight pleasant sensation even from light touch in this area. That's how you know you found the right spot. Step 2. Get your toothbrush. Use a soft bristle toothbrush. Not medium, not hard, soft. This is important. Medium and hard bristles create too much friction and can irritate the sensitive skin in this area. And make sure it's clean. You don't want bacteria near sensitive areas. I recommend having a dedicated toothbrush for this purpose that you keep separate from your oral hygiene supplies. Some men prefer to use an electric toothbrush on a low setting, which can also work well, but a manual soft bristle toothbrush is perfectly effective and gives you more control over the pressure and movement. Step 3. Apply gentle, rhythmic pressure. Place the bristles on the perineum. Press lightly, just enough to make contact. You should feel the bristles touching your skin, but you shouldn't feel any discomfort or significant pressure. Now move the toothbrush in small circular motions. Not scrubbing, not aggressive, just gentle, rhythmic circles. You can also use a slight up and down tapping motion. The goal is to create gentle vibration that stimulates the nerve without overwhelming it. Experiment with both circular and tapping motions to see which feels more effective for you. Some men respond better to one technique than the other. Step 4. Duration, 20 to 30 seconds. That's it. Set a timer if you need to. Most men feel the effect within 15 seconds, but go the full 30 to maximize the response. Count slowly in your head or use a clock with a second hand. It's easy to underestimate how long 30 seconds actually is when you're focused on a task. Many men stop after just 10 or 15 seconds, thinking they've done enough, and then wonder why the effect wasn't as strong as expected. Step 5. Timing. Do this 2 to 5 minutes before intimacy. Not 20 minutes before, not during, right before. This timing is crucial for maximum effect. The neural activation and increased blood flow peak within a few minutes of stimulation and then begin to gradually decline. By timing the technique properly, you ensure that you're at peak readiness when you need it most. What you'll feel within 10 to 20 seconds, you should notice a tingling sensation in your pelvis. This tingling is the pudendal nerve firing and sending signals through your pelvic region. Your blood flow will increase. You might start to feel the beginning of an erection forming, even without any visual or mental stimulation. That's the pudendal nerve doing its job. Some men describe a warm sensation spreading through the groin area, which is the blood flow increasing to the region. Now, this technique works on its own, but there's one bonus strategy that makes it work even better, and I need to tell you about it before we finish. This additional element can amplify the effectiveness of the technique by 30 to 50% based on what I've observed with my patients. Here's the bonus that makes this even more powerful. Combine it with your breathing. While you're doing the toothbrush technique, breathe slowly and deeply. Inhale for 4 seconds, hold it for 2, then exhale for 4, nice and slow. This breathing pattern is sometimes called box breathing or tactical breathing, and it's used by everyone from athletes to military personnel to optimize their physiological state. Why does this make a difference? Because deep breathing activates your parasympathetic nervous system. That's the part of your nervous system responsible for relaxation and arousal. It's often called the rest and digest system, and it's the opposite of the stress-driven fight-or-flight response. Erections are a parasympathetic function. They happen when your body is relaxed and feels safe. By deliberately activating your parasympathetic nervous system through controlled breathing, you're creating the ideal internal environment for sexual arousal. When you pair the physical nerve stimulation with controlled breathing, you're activating 2 different pathways simultaneously. The toothbrush stimulates the pudendal nerve directly, while the breathing calms your entire nervous system and shifts it toward arousal mode. Your body responds faster and stronger because you're sending consistent signals through multiple channels. A 2011 study in psychophysiology found that controlled breathing significantly boosted physiological arousal in men. The researchers measured various markers of sexual arousal and found that men who practiced controlled breathing showed faster and stronger responses compared to those who breathed normally. In plain English, you get harder faster. There's another benefit to the breathing component that's worth mentioning. Many men experience performance anxiety, especially as they get older and begin to worry about their ability to perform. This anxiety triggers the stress response, which actively suppresses sexual function. By incorporating controlled breathing into the technique, you're simultaneously reducing anxiety and enhancing arousal. It's a double benefit that addresses both the physical and psychological aspects of erectile function. So here's what the complete technique looks like when you put it all together. This is the full protocol that I recommend to all my patients. You find your perineum. That's the spot between your scrotum and anus, about the size of a quarter. Grab a soft bristle toothbrush, making sure it's clean and dedicated for this purpose. Apply gentle pressure with small circular motions or light tapping, keeping the contact light enough that you don't feel any discomfort. Do this for 20 to 30 seconds while taking slow, deep breaths, following the 4-2-4 breathing pattern. Inhale for 4 seconds, hold for 2 seconds, exhale for 4 seconds. And do it 2 to 5 minutes before intimacy, timing it so you're at peak effect when you need it. That's the whole system. Simple, effective, costs you absolutely nothing. No pills to buy, no prescriptions to fill, no appointments to schedule. Just you, a toothbrush, and 30 seconds of your time. Let me address some questions that men commonly ask about this technique. First, is this safe? Absolutely. You're simply stimulating a nerve through gentle external touch. There's nothing invasive or risky about it. If you experience any pain or discomfort, you're pressing too hard. Just lighten the pressure. Second, will this work for everyone? In my experience, about 80% of men notice a significant effect the first time they try it. The remaining 20% may need to adjust their technique, try different pressure levels, or practice a few times before finding what works for them. Very few men report no benefit at all, and those cases usually involve underlying medical conditions that require professional treatment. Third, can this replace medication? For men with mild to moderate erectile difficulties, this technique can sometimes provide enough support that medication isn't necessary. For men with more severe dysfunction, it can be used alongside medication to enhance the effect. I always encourage men to work with their healthcare provider to determine the best approach for their individual situation. Fourth, how often can I use this technique? There's no limit. You can use it every time you're intimate without any negative effects. In fact, some men report that regular use seems to improve their baseline erectile function over time, possibly because they're essentially exercising the neural pathway through repeated stimulation. Bottom line, your toothbrush can do more than clean your teeth. When you use it to stimulate your perineum for 20 to 30 seconds with controlled breathing, you activate the pudendal nerve, flood your penis with blood, and prime your entire system for instant hardness. I know it sounds bizarre, but the science backs it up and it works. This is one of those rare techniques that combines ancient anatomical knowledge with modern understanding of neurology to give you a practical tool for better sexual health. The beauty of this approach is that it puts you back in control. You're not dependent on a pill to kick in at the right time. You're not hoping that your body will respond the way you want it to. You have a reliable, repeatable technique that you can use whenever you need it. That sense of control alone can reduce performance anxiety and improve your confidence, which creates a positive cycle of better sexual experiences. Try it tonight. Follow the instructions exactly as I've described them. Pay attention to what you feel and how your body responds. Come back and drop a comment telling me what happened. I love hearing from men who've discovered this technique and experienced the results for themselves. Thank you for watching. I'm Dr. Elena, and my mission is to help men over 60 reclaim their vitality and confidence using science-backed, natural methods. If this video was helpful, please like it so more men can discover this information. Subscribe to the channel for more content like this, and hit the notification bell so you don't miss future videos. Take care of yourself, gentlemen. Your health and vitality matter, and there are simple, effective solutions available if you know where to look. I'll see you in the next one. Remove these words.